Okay, so I think we're good to go. So good evening, everyone, and welcome to this evening's webinar. Just to let you know that this webinar is being recorded. And for those of you who may not be familiar with the webinar format, you are joining on a Zoom webinar as opposed to a Zoom meeting. So that means that as you join, your camera is disabled and you are on mute. So you won't be able to use those functions throughout the meeting. If you do want to engage with the if you do want to engage with the panel over the course of the evening, we do encourage you to do so. You can use the Q&A function, and you will find that along the bottom of your screen. The Q&A function, just click into that and ask your questions there. And we'll be keeping an eye on that function, and we will endeavour to answer as many questions as possible over the course of the evening. So with that, I will hand you over to your host for this evening, Ailish Houlihan.
Good evening, everybody. You're all very welcome, and I'm delighted to welcome you to this special online event for the Erris community, which is focusing on minding your heart health. This event has been organised by your local heart and stroke charity Croí as part of Croí's Third Age Mayo programme. Through the Third Age programme, Croí are putting the spotlight on heart health, especially for people over the age of 55. And the reason for this is because heart disease, stroke and diabetes are more common as we get older. And Croí want to put an important focus on prevention and also management of these conditions. The good news is, however, if detected early, many of these heart conditions such as blood pressure, high blood pressure, heart failure and atrial fibrillation, which is an irregular heart rhythm, can be treated and managed so that people can live a longer and healthier life. I would like to acknowledge Vermillion Energy for their support this evening, and thank you to them. And I'm delighted to be joined by two esteemed colleagues this evening. Welcome to Professor Jim Crowley, who is a consultant cardiologist in University Hospital Galway and also medical director at Croí. Thank you, Jim, for joining us this evening. And also welcome to Zoe McCrudden, who works as a cardiovascular nurse specialist in Croí. Thank you both for joining me. This webinar, as Annie has mentioned, is in a Q&A format, which means we are very open to receiving your questions this evening, and we'll endeavour to answer as many of them as we can over the next hour or so. Many of you have already sent queries and questions and concerns into us this evening, and we'll hopefully address all of those, or as many as we can, over the course of the evening. So for now, whether you are joining us from Croí or Belmullet Town, Bangor, Erris, Blacksod, or indeed further afield, you're most welcome this evening. And we look forward to answering your concerns and any related queries you have in regards to your heart health over the next hour. So to get started, I might go to you, Jim, first, if that's okay, just to set the scene for the evening. And my big question at the moment is, how big a problem is heart disease and stroke in Ireland?
And thanks very much, Ailish, and thanks for inviting me to be at this meeting. Yeah, it is obviously a very big problem, and when we look at all the causes of death in Ireland today, cardiovascular disease, and that's mainly death from diseases of the heart or stroke, and a few other less common conditions such as aortic aneurysm, account for about 40% of all deaths in Ireland today, and about every year, around 10,000 people in Ireland die from some form of cardiovascular disease. It remains the biggest killer in Ireland today.
Okay, thank you. Thank you for that, Jim. And maybe to move to you, Zoe, we hear a lot, and particularly from our local heart charity, Croí, and they've really worked so hard over the last number of years about prevention and communicating that message to us and the general public, all about the importance of making lifestyle changes. But how much of a difference does lifestyle change really make?
It's huge. So as Jim said there, it's the biggest killer in Ireland, but it's at least 80% preventable, which is the message we want to get across, that, you know, you can take ownership of it, you can make a difference, you can change that and reduce your risk. So I suppose the take home message is it is 80%, at least 80% preventable.
That's really encouraging news and really good for us, I suppose, to know that even with small lifestyle changes, we can make a difference. So that's really good news to hear this evening. The research indicates as well, Zoe, that apparently sitting is now being regarded as the new smoking. Would you mind commenting on this, please?
Yeah, there's been a lot of research into this recently, that sitting is kind of now classed as a risk factor in itself, because I suppose probably with COVID as well, everyone's working from home, we're spending a lot more time sat down. And it's a huge risk, we're not as active, and being physically inactive by sitting down, it is a risk in itself now, just as big of a risk as smoking, some of the studies would indicate. And it's one that's easy to reduce, to prevent, just by getting up and walking around, stretch the legs every 5 minutes,
Okay. And even if you're very active, so let's say I'm working all day in an office or sitting down, as you say, maybe with the laptop a lot more than usual, and I'm 40 odd years of age, but I still go out every evening and I do my 30 minutes walking. Is that not enough?
That's brilliant, because you're getting in your 30 minutes of exercise, but it's still, you still need to try and reduce that sitting time. So literally, even if it's having a glass of water and making sure every hour you get up and stretch the legs or go to the bathroom or just do a lap of the house, just something so you're not sat solidly for that long length of time, which I think we can, we have awful bad habits sometimes of having had lunch at the desk and taking phone calls at the desk. So even little tips like when you have a phone call, stand up and take it, so you're still doing your work, but at least you're kind of moving around a bit. So it's just movement. It's not even just, you don't have to go running a marathon or anything. It's more just being active. And my colleague Caroline, who works with Croí, is the exercise specialist, she does a great session on how we can be more active and reduce our sitting time and kind of reduce being our physical inactivity, which is on the Heartlink West chats, which is great. She's full of information on how we can manage that.
Very good. So basically the message or the take home is move more, sit less.
Yes, definitely.
Great stuff. I mentioned the Croí Third Age Mayo programme, which is a really exciting programme. And for myself and my colleagues in health and wellbeing, we're really excited to be partnering on this initiative with Croí. Can you tell us a little bit more about this programme and also maybe talk us through the key message that's coming from the third age, which is own it, check it, sort it?
Yeah, so as you said there before, it's putting the spotlight on people in the middle age of life, so those over 55 in particular. And it's kind of, we want to empower people to take ownership of their health. And they could do this by owning it. So acknowledging if there is a problem, so get your blood pressure checked, get your cholesterol checked, look at your weight, know your numbers, kind of look at if you have any risk factors and look what you can do to take control of it. So check it, as I said, get off to the GP, go and have your bloods taken, have your blood pressure checked, know your numbers again and sort it. What can you do? Make small changes to your lifestyle, because they will make a big impact. It's never too late to make a change. Even something as simple as stopping using salt, it can have a huge benefit to your health by improving your blood pressure, for example.
Okay, very good. So the sorted being a really key one. So not only knowing your numbers, but doing something about it. And hopefully, as we say, implementing those 2 or 3 key changes that might make a difference. And actually, just to finish off maybe there, the point about, I think people can get a little bit overwhelmed sometimes. They feel, my blood pressure is up, my cholesterol is up, I've been told this, that, and the other thing that I need to turn around my lifestyle. It can seem very daunting sometimes and maybe be off-putting for a lot of people. So what's the key there, Zoe?
Yeah, so often people will say that to us. They're like, I know what I'm doing. I know my blood pressure is too high, or I know my cholesterol is too high, and it's almost like bury the head in the sand. So it is, just pick one small thing. Even if it is literally just like, I'm not going to use salt, or I'm going to half the amount of sugar in my tea, and just focus on that, work on that, and then maybe down the line you can add something else in, because it needs to be kind of what we'd call a SMART goal. So specific, it's measurable, it's achievable, it's realistic, and it's timely. So just something that simple. Dr. Lisa Hines, the health psychologist, does a great session on how we can make these small changes and why it's so difficult. And one of her favorite sayings is kind of apple pie will always taste better than apples, but it's looking at why it's so difficult to change, but how we can do it. But it is one small step at a time.
Very good. Good advice. Great stuff. So we've lots of questions coming in, and we have lots of questions that have already been sent to us. So I'm going to try and take it in themes over the course of the next while. So Jim, if I could go to you, one of the questions that came in to us is, my father had cardiac stents fitted and had a serious heart attack in his late 70s. My mother also had stents fitted, had atrial fibrillation that could not be resolved, and had developed heart failure since her late 70s. How much does this extensive family history of heart disease increase my own risk? Now, there's no details on the age of the person that put in the question, but just generally, please, Jim.
Well, I mean, it's interesting enough. The two parents developed heart disease at a relatively late stage in life. And that sounds like from the message there. So actually, the risk conferred onto the next generation is probably not that large. What's probably more important, we look at first degree relatives below the age of 65 as being the key, family risk factors, if you like. But what's probably more important is what the person's levels of blood pressure are like, what their cholesterol is like, whether they smoke or not, what their exercise level is like, as we've talked about already. So there's nothing you can do about your own family risk factors, but you can do a lot about all the other things that we talk about all the time.
Mm-hmm.
And just to get back to actually earlier on, before we begin to think that heart disease is all doom and gloom, the results of heart disease, it's in many ways it's a success story. If you go back over the last 20 or 30 years, the number of people who are dying from heart disease, even though the numbers seem to be very high, actually have significantly improved. And this is because of changes, particularly in lifestyle, but also because of drug therapies and so on that we can do for this condition. So, I suppose what it shows is that when we take ownership of our own risk factors, that substantial differences can be made to our own risk in the long run. So to get back to the question, I think for this particular individual, I think the family history is probably not as strong as it sounds, because the first degree relatives were over the age of 65, but it's the other risk factors that you can actually change that probably would have a bigger impact on your own risk.
Great stuff. Thank you, Jim, for that. And you mentioned the word risk factors quite a lot on that, and you mentioned blood pressure and cholesterol. Yeah. Can you talk us through those risk factors and any other risk factors that we should be aware of?
Yeah. Well, there's an awful lot of research has gone into this over the last 30 or 40 years. And it's pretty clear that there are a number of basic so-called risk factors that increase your risk of getting heart disease. And there's a lot of, and there has been a lot in the literature about unusual causes of risk factors for heart disease, such as fibrinogen levels, or and we talked about different things over the years. But what has been shown is that the major risk factors are all the common stuff that we talk about for years. So we talk about blood pressure, cholesterol, diet, weight, exercise, cigarette smoking. These are the so-called modifiable risk factors. These are things that you can do something about. And we know that these account for the vast majority of the differences in the incidence of heart disease between countries that have a high risk, have high incidence of heart disease, and those that have low incidence of heart disease. When we talk about risk factor, what we mean is that if you have these things, if you have a high cholesterol or high, or if you smoke or high blood pressure and so on, then that makes you more likely to develop heart disease or stroke in the long run than if you don't. It doesn't mean that you will, and it doesn't mean that if you don't have them, you definitely won't. It just means it's a lot more likely that if you have risk factors, and the more you have of them and the more out of control they are, the more likely you are to develop heart disease.
Okay, thank you for that. So I suppose it brings us nicely actually to the next set of questions, and very much looking individually at these risk factors. So if we can tease it out that bit more. So I suppose we'll start with blood pressure, but before I even do that, actually, I might just throw it out to you, Zoe. What age should people have their risk factors such as blood pressure and cholesterol checked?
To be honest, you're never too young or old to have them checked. So anytime, the sooner you get them checked, and if there's a problem, the sooner you can address it, which reduces your risk. So as Jim said, having a high blood pressure isn't necessarily a risk if it's managed, but it's knowing that it's there and it's being treated. as opposed to ignoring it until you're kind of in your 60s, then it's much more of a problem. Whereas if you address it, if it's an issue when you're younger, you know, you've reduced that risk.
So I suppose the message being that we'd encourage people to take that NCT, to take a trip to the GP, and get a baseline at least, and then from there they know their numbers, and then they can work on them, and make a follow-up plan with their GP then.
Yeah, and that's a big thing as well. And I think sometimes as healthcare professionals, we can be guilty of saying, you know, doing someone's blood pressure and saying, oh, it's grand, you know, and I want people to say, okay, thanks for that, but what does it's grand mean? What are the numbers? You know, because the general public should be aiming for a blood pressure with the top number being less than 140 and the bottom number being less than 90. You know, if you're consistently getting numbers above that, then it's too high. You know, and if you kind of say to your GP or your practice nurse, or even if you're checking it at home, if you're getting numbers above that consistently, that's too high. And if you say, what can I do? They'd be delighted, because you're taking an active role in what, you know, you're managing your health, you know, so don't be afraid to say, this is what I'm getting, what can we do to address it? You know, it's really important.
Thanks, Zoe. And so you've given us the tip on knowing the number means having, or knowing that the recommended is to have the top number or the systolic reading below 140 and the bottom number, the diastolic, under 90. But to even take us back a step, in explaining that to somebody, would you mind explaining what is blood pressure itself anyway, and what do those two numbers mean, please?
Yeah, so blood pressure is you'll see it as two numbers. So the top number, the systolic, is the force at which the blood is pumped around, the maximum force. So that number is always higher. And then the bottom number, the diastolic, is the relaxation phase of blood pressure. So that number is always lower. So you should always have a blood pressure with the top number being the big one and the bottom number being less. But there's always two sets of numbers.
Okay, and how are you going to know that it's high? So I know we say we encourage people to go and have that NCT, have the blood pressure checked. But apart from that, though, if you're at home and you're wondering, look, I get headaches, or, you know, are there signs we should be looking out for?
Sometimes if it's exceedingly high, then you might get headaches. But, you know, high blood pressure is known as the silent killer for a reason, because we don't get any warning signs. You know, it doesn't come with symptoms, or, you know, it's there in the background causing a problem, and we don't know about it unless we get it checked. So it's really important just to, you know, to have it checked, even if it's doing it at home, even if it's your mom or your granny's got a BP machine, just pop it on and check what your blood pressure is. You know, there's loads of videos on the Croí website of how to properly check your blood pressure, and there's lots of information as well reminding you what the numbers are and what they should be, you know, because I'm conscious not everyone will remember that, but the main thing is checking it, making note of the numbers, and then seeing kind of where you are in terms of, is it high, or is it too high?
Okay, good stuff. And Jim, we have a question in here from a man that is 73, recently told that his blood pressure is high, and what he means by high, he has the numbers here of 170 over 105. My question is this not normal for my age? So again, he's 73.
Yeah, no, that's not normal. That is a high reading. It used to be that we used to look at your 120 plus your age is the normal, but it isn't really. We do need to try and get the blood pressure below 140 over 90. If it's persistently at that level, then it does need to be addressed. Now, it may be that was one single reading, so it may be that if it's checked again and under the right circumstances, it will be a lot better. And if it is kind of borderline, then there are other things we can do, such as get a 24-hour blood pressure monitor. Your GP can arrange that, where monitors put on and records your blood pressure over a 24-hour period, and that gives us an even more accurate assessment of what your blood pressure, your average blood pressure levels are like throughout the day and the night. But a single reading often may be an indicator that there's a problem, but it's often not enough to require management or change in diet or a change or initiation of drug therapy.
Okay.
So I would think a single reading like that is high reading. It is significantly elevated reading. It does need to be followed up, and potentially it does require treatment.
Okay, so it sparks the conversation of, you know, needing to get it reviewed again, having maybe multiple readings, and as you suggested, a 24-hour monitor would be a good course there to take. You mentioned, and I think maybe Zoe as well, you mentioned something about home monitoring, having a home blood pressure monitor. Zoe, what are the thoughts about this? Should, you know, I know we have one question in here. If I take back a look here, what do you think about home blood pressure monitoring? Should I be doing it every day? Is the question from somebody.
No, unless you've been told to do it every day, you don't need to. Like, you know, it's not something we should focus on. You know, don't be obsessed with it. The best thing to do is, if you've been told you may have a high blood pressure or you're concerned you're getting high readings, then just randomly take it and make a note. Say if it's breakfast, if it's lunch, you know, if you've just been gardening or something that's going to put your heart rate up, and make those notes. But just as a 24-hour over a 24-hour period, and by that I don't mean get up in the middle of the night and check it either, because that's not really practical. But there is some research now that says that it is, you know, because some people don't like having the 24-hour monitors, or it's been very difficult to get them to have a 24-hour monitor because GPs are so busy currently. But so, you know, you can check it at home and keep a record. It can be just as effective. And again, we've a list on the Croí page of kind of recommended monitors, and just make sure that you're checking your blood pressure properly, you know, that the cuff's in the right place, and different things, because that will give you a high reading if you're not doing it correctly.
Okay.
But also we mentioned it there briefly at the beginning with the Third Age project. A lot of that will be focusing on high blood pressure, and it's just for those in Mayo. So, you know, that might be of interest for people that are concerned they might have high blood pressure or they want to get theirs checked. You know, so take advantage of that. It's available for the over 55s in Mayo.
Great stuff. Thank you for that.
Yeah, I think it should be done in conjunction with your GP as well, to some degree. You know, trying to check your own blood pressure. I certainly wouldn't recommend taking your blood pressure every day if there's no, if you're not doing it in conjunction with your GP, because you may get readings that are falsely high and that will cause you to be alarmed. But also you might get readings that are falsely low if you're not doing it properly, and therefore you might miss the high readings. I think taking a blood pressure at home can be really useful. You know, particularly if a reading has been found by the GP to be particularly high, but there may be, you know, the patient may be anxious and so on. And so when you go home, you might find that the blood pressures are an awful lot better. And sometimes when you're started on therapy, it may be very useful to have home blood pressure readings done, again in conjunction with the GP, because as Zoe says, and on the other side of this, you don't want to be obsessive about blood pressure measurement. You just want to know what it is and to make sure that it's within reasonable levels. So if you have a blood pressure problem, it may need to be checked more frequently. But if you're, you know, certainly if you have a reading that looks high on a home monitor, you need to see your GP. And you should keep in touch with your GP a couple of times a year, even if your blood pressure is okay, because as you get older, it may get higher.
Okay. Thank you for that, Jim. And final question, maybe under the blood pressure theme for the moment anyway, is I'm on blood pressure tablets for 10 years now and I'm 45. I worry about the effects the tablets may have in the future. Is it hereditary if I'm not overweight and I exercise? So there's probably two questions in that.
Well, I just, first of all, if your blood pressure is under good control on the antihypertensive drug therapy, then that's really good. That has reduced your risk of getting a stroke or a heart attack in the long term. The side effects, generally speaking, drugs for blood pressure are well understood and have been around for a long time. And generally speaking, they're extremely well tolerated. Occasionally, there are problems such as changes in the potassium levels in the blood, or fatigue, or other symptoms like that. Generally, they occur relatively early on in the drug therapy when it started, you know, within a few months of it starting. And if you've been on the drugs for years, it's very unlikely that you're going to develop side effects at this stage. And if it is uncontrolled, then you're in a better position than you would have been if you didn't have these drugs. So I'd recommend you just keep taking them and not worry about it.
Okay, great stuff. Well, thank you for that. So moving on to the theme of cholesterol, the first question I have here, Zoe, I might come to yourself. My cholesterol level is above 7 and my doctor wants me to start medication, but I want to start with diet and exercise first. Will these help?
Okay, so first of all, I suppose with cholesterol, it's just to make sure when you get your cholesterol, you get several numbers. So the main ones we would look at is the HDL. So we remember it as the happy cholesterol. So and we want that one high. You know, anything above 1.4 is good, or you know, because the good cholesterol helps to get rid of the bad cholesterol. So it can't really be too high. Then the other cholesterol that we particularly look at is the LDL. So remember that as the lousy one, and we want that low as possible. That's the one that kind of, you've got a little toy here. You know, so the LDL, the lousy one, it's what causes this narrow into our arteries, and that's the one we want to get rid of. So, you know, it's really important to yes, you have a high cholesterol, but look at what the LDL is, and when you have your bloods taken, focus on that one improving. Yes, diet and exercise can have a huge impact on our cholesterol, but if the LDL is that high, you know, you probably do need a medication as well, because they will only reduce the cholesterol by so much, you know, the LDL. So medication in combination with diet and exercise changes would be the most effective treatment.
Okay. And for the cheese lovers out there, how bad is cheese?
Well, like we'd say, kind of avoid animal fats are the kind of the worst offenders, so cheese and butter and cream and all that good stuff. But we've got to be realistic. You know, you need to enjoy your food. We can't say you never have butter, never have cheese. But it's in moderation, and looking at how much you're having, when you're having it, and then what effect it's having on the cholesterol. So again, Ailish, who's the dietitian with Croí, she is brilliant on, and she does a session purely on eating for cholesterol, you know, and she'll go into detail on what you should be eating, what you shouldn't be eating, and how much of different things we should be having. But it's all in moderation. So we wouldn't ever say never eat it, but it's just portion size and kind of managing it that way.
I always love the message too of, you know, it's not always about what you take away, but maybe what you need to start including. So increasing the fruit and veg and increasing the fiber can help the cholesterol as well. I like that one. I hate thinking of all the things I have to give up.
Exactly. You know, Ailish goes, they eat the rainbow. So as many different coloured fruit and vegetables as possible. And she's a great believer in a bowl of porridge for breakfast, because they have huge benefit on the cholesterol.
Okay, good stuff. That's great. Jim, there's a question here that I might direct to yourself. What LDL should I be aiming for after a heart attack?
Well, the current guidelines suggest that you aim for about 1.8 in LDL, or as low as 1.8. Now that is quite a difficult number to achieve, and you will almost certainly require drug therapy to get to that level. So it will be diet, it will be exercise, but it will almost certainly require a drug therapy, probably with the most common drug used, which is a statin. The lower you get it, it's interesting to look at the trials of cholesterol lowering that have gone on over the last, I suppose, 30 years now. I remember when I was a medical student, it used to be that we used to aim for a total cholesterol of less than 7, which we would consider to be high now. And then it fell to 6.5, and then to 5.2, and now it's 4.8. And the LDL, or the bad cholesterol, as Zoe was talking about, we want that to be as low as 1.8 if we can.
Is it 1.4 now? Sorry, Jim.
1.4, yeah.
I think
1.4.
it's dropped even further now. It's even harder to get to.
Yeah, it's going down. Sorry about that. It's 1.4. But even with the drug therapy, it can be quite difficult to get down to that level, you know. So that's the target.
Okay. And then I suppose so many people have presented with questions on statins and their concerns around statins.
Yeah.
One question here in particular: what are the effects of taking statins for a lifetime? I'm concerned about the side effects of taking these medications for years.
Yeah, and it's a good question. And there's always, and there certainly was a lot of controversy around the statins a number of years ago. It was associated with a lot of different side effects, or at least thought to be associated with a lot of different side effects. The most common side effects associated with statins are aches and pains, muscle aches and pains. And this occurs in about 5% of people. Now, the problem is, of course, everybody has aches and pains. So if you start on the statins and you get an ache and pain, everybody thinks it's related to the statin, but most of the time it's not. Statins are very well tolerated and have been studied extensively. There's hundreds of trials have shown that the statins work very effectively at reducing down cholesterol by up to 30 or 40%, and that they significantly reduce mortality. So unlike a lot of drugs, statins have been tested in patients, and we have looked at not just their effect on cholesterol, but their effect on mortality. So they have been associated with significant reductions in mortality associated with how effective they are. So the data is very strong. Long term, yes, there are very rare side effects with statins that can affect the liver, and very, very rarely it can cause severe liver problems. And it can also cause, exceptionally rarely, severe muscle problems. Generally speaking, these occur relatively early in the course of using these drugs, and when you stop them, generally speaking, it's reversible as well. And they are the first line drug for reducing cholesterol because they are so effective. There are a number of other agents, but they're not nearly as good as statins for using these agents. And there are newer drugs in the market which are injectables, which are probably better, or even better than statins. But so far, they are only available for a highly selected group of individuals with exceptionally high cholesterol levels.
Okay, thank you for that. I might stay with you for the final question in this section, Jim, and there's a question in here. Can you still develop blockages if you have what would be regarded as safe LDL and HDL levels in blood tests?
Yeah, no, this gets back to the whole idea of risk factors. You know, if you have safe LDL and cholesterol levels, that means that you don't have, for you, high cholesterol is not a risk factor for heart disease. But that means, but you could potentially have other risk factors. There could be a familial risk as well. And, you know, in a number of individuals, we will see them coming in who have no risk factors whatsoever, and they still have heart disease. So what we're saying about risk factors is that if you have them, you're a bit more likely to get heart disease. If you don't have them, you're much less likely to get heart disease. But it doesn't mean it's zero. It doesn't mean the risk is zero. So you could definitely get heart disease, even if everything is perfect, but you're just a lot less likely to get it.
Okay. And actually, I've missed out on one question here I might go back to before we move away from the cholesterol theme, Zoe. Just if I could ask you to comment, because there have been a few questions in on this, is to comment on the role of cholesterol lowering products that are on the market today. So the spreads or the yogurt drinks or the red yeast. Have you any comments to make on that?
Yeah, so I suppose if you're going to buy a product, the best one to buy, and the one we would probably only advocate, would be the one that's in a yogurt, because it's a pre-portioned amount, like one is enough. It's similar to another drug that we use called ezetimibe. So if you're already on that medication, there's no point in using the spreads or the yogurt, because you know you're already on a tablet that's going to do that. They don't take the place of the statins. If you're on a statin, that is the first line treatment and the most effective treatment for managing cholesterol, but there is a place for the spreads and the yogurts. Now, supplements and things that you can buy in the health food shop, such as red yeast, I would say no. You know, it's not kind of looked at and kind of scrutinized as much as the drugs that we would prescribe. I mean, if it worked, then they would be FDA approved and we would prescribe them and recommend them. So I would advise people against kind of different tonics and supplements they can get in the health food shops maybe. You know, the best thing to do is take your medication as prescribed by your cardiologist or your GP. Do your exercise and look at your diet. And again, we do this Heartlink West session specifically on exercise or diet to improve cholesterol.
Okay. And if you do want to choose one of those products, the one that would be probably strongly, or not strongly recommended, but at least has the evidence behind it, maybe, is the yogurt drinks.
Yeah, and I'm not saying that the spreads don't work. It's just it's very hard to get that amount of, you know, spread per day, like as a portioned amount, whereas at least the yogurt is a portioned amount. But yeah, you're best looking at the whole of your diet and taking the statin.
because otherwise you're trying to balance with taking a lot of spread and probably potentially putting up some weight, and weight is going to have a negative effect on the cholesterol as well. So that makes sense. Great stuff. So I'm going to move on to some queries. Actually, there's one in here related to COVID, which I think is really important that we address this evening. And I know this would have been a question that came in to the Croí Heartlink West helpline in recent times. Jim, if I could go to you, the question is, I have recently been experiencing some indigestion, more than normal. And when I walk up a hill, I sometimes get breathless. Should I be concerned? I really don't want to be bothering my GP as they're so busy, especially now with COVID. Could you talk us through that, Jim, please?
Yeah, so this is a patient that is getting short of breath when they walk and also gets, did you say stomach?
Indigestion.
Indigestion, yeah. Well, you know, the fact that these symptoms are related to exercise is of concern. If you have symptoms like that, which you would describe as indigestion or discomfort in the chest or the squeezing, or sometimes it can be very minimal, or if you get a pain in the left arm, and if it recurs with exercise, and you know that, or if you find that some people find that they're avoiding exercise because they recognize that something is wrong and they just don't want to push it, absolutely that needs to be seen and discussed with the GP. And it's not enough to just sit back and hope it goes away, because it may be nothing. It may be indigestion. Because we know you can get indigestion when you're doing exercise if you have a tendency to it. But indigestion can be, you know, for one person is indigestion, for another person it's a heart problem. And it could potentially be a sign of, it could be what we call the angina equivalent, a sign of a blocked artery. And it definitely needs to be followed up.
And I suppose over the course of the last year, and we know this from many of our colleagues and patients and service users, is that people have been so worried about catching COVID or presenting themselves to a waiting room and being so nervous that, look, if I go into A&E and I'm waiting for hours, I could catch COVID, and that would be worse than dealing with what's going on for me. Yeah. What do you say to those people?
Well, you know, you have to look after your health. If you're getting symptoms, particularly if from a heart point of view, if you're getting symptoms that are reproducible with exercise, they should be investigated, because certainly if it's something that's out of kilter with your normal, how you feel normally when you're doing exercise, that could potentially be a sign of heart disease in a blocked artery. So that needs to be investigated. It's very important. And some people think maybe I have COVID or whatever, but you shouldn't really second guess it, you know. I know, and you know, when patients come in like this to us and we examine them, the examination might be entirely normal, and it's very difficult for us to know at the time, in many cases, whether these symptoms are related to the heart or not, and we often then refer them on for investigations. So, you know, even with medical training and many years experience of seeing patients, it may be impossible to be sure. So you shouldn't take the chance. It's you know, it could be, you know, these could be signs of an imminent heart attack at some point. So they do need to be checked out.
And any encouragement, or have you seen a nervousness as such about people presenting to hospital over the last year?
Absolutely. It's very clear, you know, that patients have been staying away from the ER. There has been, up to recently anyway, there has been a dramatic fall in the number of patients who are presenting to the ER. And we are concerned that there may be a lot of patients out there who have failed to come in to the ER or come in to see their GPs for fear that they might either get COVID or that they don't want to bother the GP because they think they're too, you know, that because of these circumstances that we're under. And, you know, we are worried that there may be a backlash from all of this over the next year or so because patients have waited too late. So I'd be very, you know, if there are symptoms, they need to be checked. There's no point in putting it off, you know, even if it does mean significant delays, whatever, you know.
Okay, good stuff. Zoe, a question for you on heart health and women. I've heard women have different kind of heart attacks to men. Can you explain? And this is from a female who is mid-50s.
Sometimes they can possibly have different symptoms or signs of a heart attack. But I suppose the big thing is anything that doesn't feel right, you should get it checked. You know, if you suddenly start to get breathless, if you start to get an indigestion pain or pain in one of your arms or up into the jaw, nausea or vomiting, you know, something that just doesn't feel right that's come out of the blue, you should always get it checked. you know, the longer you leave it, if it is something cardiac particularly, the more damage you're going to cause. So, you know, it's much better to go and get it checked and be told it's fine than leave it and potentially, you know, have a much bigger problem then. But sometimes, yes, they can be slightly different. Women's symptoms can be more subtle. So I suppose it's just know your body and what's normal for you, and then anything that's not, you know, take note and get it checked.
Okay. Jim, a question in here: have had 4 stents inserted recently, have been reviewed in OPD since. Is it recommended to have them checked in time?
Yeah, that's a very good question. I think the important thing is that you've had stents put in, which means that you've had significant blockages in the arteries to your heart, which means that you, no matter what you do have a risk that you might develop future narrowings in the future again. So it is even more important for you to, again, pay attention to all the risk factors: blood pressure, diet, exercise, control of diabetes, high blood, cigarette smoking, and all of that. So yes, you should keep in touch with your GP. Potentially, you would need to keep in touch with your cardiologist for a year or two. In the long run, whether you should have a further angiogram or not is very debatable. We tend to be driven a lot by symptoms. So if the patient has no symptoms, we tend to continue to just advocate in terms of drug therapy and management of risk factors. But if there are any symptoms, we're very quick to go back and go for invasive investigations rather than non-invasive investigations of patient symptoms. There's a lot of debate over this, whether patients should have angiograms or not. We can't doing the more angiograms you have, there's always a chance that you could potentially have a complication during the procedure. So we don't advocate for that. But we can use exercise testing, which is a non-invasive test, for during checkups. And we certainly will be very quick to investigate patients who have any hint of a recurrence of angina, because we know that these patients who've had stents put in are at a higher risk of developing further narrowings in the future.
Okay. And maybe related to that then, if I could ask you a further question, because it has come in, is there a less invasive procedure to evaluate the coronary arteries other than angiogram? And maybe taking in mind the question previously from the person that was worried, should they be getting their stents checked in time?
Yeah, well, there are a number of different tests. There are different ways we can look at the heart in patients who've had coronary artery disease and in those who are worried that they might have it. We can do non-invasive testing, such as stress testing, where we get a patient to walk on a treadmill and can look at the ECG during that. And that's a very useful test for evaluating coronary artery disease in certain circumstances. There's a test now called a CAT scan, a CT coronary angiogram, and that allows us to evaluate the coronary arteries in a very good way. And it's a relatively non-invasive test. We do inject some dye into the vein, but we don't have to put catheters into the heart. That is particularly useful in patients who are considered to be at moderate risk, not high risk, but moderate risk of a heart attack, of having coronary arteries when they come in with symptoms. It's very useful in identifying individuals where the coronary arteries are completely normal, so it divides up patients into those who have arteries that are completely normal and those who have arteries that look a little bit abnormal. And the ones, but it's not very good in determining whether patients have very significant coronary artery disease, differentiating between slightly abnormal and very abnormal coronary arteries. So it is very useful for assessing patients who have symptoms suggestive of angina, and if they have a CT coronary angiogram done that's entirely normal, then effectively angina can be ruled out. In patients who have a CT coronary angiogram where it suggests that there may be coronary artery disease, then many of these will need to go ahead and have an invasive coronary angiogram done to find out if they have significant disease. It was very useful that way.
Okay. So just moving on then in theme as such, but very relevant this evening, for those who are living with a heart condition at the moment, I suppose the key message that we'd like to put across is that self-management with long-term health conditions such as heart conditions is so important, and that for people to realise and understand that they have an important role in their own healthcare and looking after their health condition. And we know that self-management is what a person does every day to manage and live with their health condition. And some of these things might be recognizing and dealing with symptoms, taking medication, attending their GP or other healthcare professionals, making lifestyle changes, and also coping with the effects emotionally of having a long-term health condition. And to do this well, we know it's important for people to have the right access to education, supports, structures, services, and all the rest. So Zoe, from a Croí perspective, would you mind talking us through some of the supports and services that Croí offer to people who are trying to manage, whether it's high blood pressure or heart failure in the community in Erris? What's out there for them?
Yeah, so Croí offer loads of different supports. So there's the Heartlink West phone line. You can always ring up and speak to a nurse. You know, if you have any questions, there's something you're not sure about, they will always call you back and answer any questions and point you in the right direction. We do, they do something called the Heartlink West chats. So these run every Thursday at 11 o'clock, generally for around an hour. Bit like today, it's a webinar. We encourage you to ask questions and kind of participate, but if you're more comfortable, you can sit and watch. And they're on a variety of topics with the health team. So looking after your emotional health with our health psychologist, Dr. Lisa Hines, looking at diet for weight loss, diet for cholesterol, diet for blood pressure. They're all separate sessions. There's a session on exercise, you know, there's individual ones on risk factor management. So there's a whole variety of topics that they kind of, and it's on a sort of a rotation. So each week it's a different topic. So you can always phone up and ask which topics are coming up or when the one you're particularly interested is on. There's always loads of information on the Croí website. If you're into social media, they're on Twitter and Facebook and Instagram. They've a fab comms team that are always kind of putting the message out there, and you know, any new things that are coming up. You know, there's lots of different sessions like today. You know, like this is just for the people in Northwest Mayo. So, but you know, there's always something of it going on with Croí. You know, and hopefully now with COVID starting to, you know, starting to get back control, they do great sessions in the gym as well. They have a lovely fitness suite up in the building in Croí. They run a whole variety of exercise classes and programs there. Lifestyle management, and kind of there's sort of returning to exercise if you've had a cardiac event. There's Pilates, yoga, there's so much going on. I mean, if you give them a call or look on the website or social media, there's always something going on with Croí. And then again, there's the Mayo special event for the Third Age project, which is coming very soon to Mayo. So, you know, keep a lookout for that. I'm sure you'll be seeing it around the pharmacies and out in Mayo now.
Very good, and I know that more information is provided about the Third Age programme on the Croí website. So that leads us on quite nicely. You mentioned there the gym and exercise and you know, getting back after an event, and it leads me nicely to probably the two final queries of the evening, which are relevant to self-management and self-management support, but particularly looking at cardiac rehab. Jim, if I could start with you. The question is, I have recently had 2 stents inserted and I've never felt better. My doctor recommended I do cardiac rehab, but I don't see the need now, as I believe the problem has been fixed. This is from a male who is 51 years of age.
Yeah, well, you know, when you have a blocked artery and you fix it with a stent, the blocked artery is an indicator that there's a problem and that there's a tendency to develop blocked arteries and a potential tendency to get heart attacks in the future. The stenting just fixes the tight one, the one that causes the problem. It doesn't fix the underlying process. And cardiac rehabilitation will give you not only the information, but also provide you with exercises and particularly provides you with an awful lot of information about the disease and about your understanding of the disease and how you can modify all of those risk factors that will reduce the risk for you in the future. And it has been shown, even by studies, we have studied the use of cardiac rehabilitation across the world, and we know that patients who participate in cardiac rehabilitation have a significantly reduced mortality after they've had a cardiac event. So cardiac rehabilitation is like getting drug therapy. It works as well, if not better, and it is very important. And I would stress somebody at your age in particular, relatively young age, to be getting a heart attack or to be getting stents inserted, that they should participate in the cardiac rehab program.
Okay, that's great. And thank you, Jim. And I suppose encouraging information to attend cardiac rehab, but also noting that we have a cardiac rehab department here in Mayo University Hospital. And so that is a place for, as you say, education, support, exercise, and general information on how to get back to living well after a cardiac event. So thank you for that, Jim. And the last one, I suppose, as such, Zoe, I might come to you. I'm 11 years post triple bypass. I didn't do any rehab at the time. I have since had a carotid artery blockage and feel quite vulnerable at this stage. Are there programs out there for me, male, 78 years of age?
So again, as Jim said, cardiac, it's a shame he couldn't do the cardiac rehab program for whatever reason. But a lot of it is the information you get on the cardiac rehab sessions. It's looking at the underlying risk factors, why it happened, and what you can do to prevent it and minimize it from happening again, or prevent any blockages getting worse. So you look at your what exercise you do. They teach you what the best exercise for you is and how and when you should exercise. Looking at your medication, telling you about them, why it's important, the different types and how they work. Looking at your lifestyle, what you eat, when you eat. Have you got stress? Looking at how you can deal with stress, because that's a huge risk factor as well in itself, that's often overlooked. Smoking, helping you and supporting you to quit smoking, taking ownership of, like, if you've diabetes or any other little risk factors that you may have, they will tailor it to you. So if you can get on any rehab programs, great. I know unfortunately with COVID there's a backlog, but the positive is a lot of virtual programs are coming out now, which makes it more accessible, especially for people that have small children or they're working. It's an option now. There's sessions, like I keep saying, the Heartlink West chats, that will cover all the individual topics that make up the education component of a cardiac rehab program. So I suppose it's kind of knowledge is power, and looking at everything and then relating it to yourself, what your own risks are, and then trying to manage it. And again, you can always call the Heartlink West nurse as well for any advice, or speak to us in Croí, or speak to your GP, speak to your local, see if it is possible to refer you to your local cardiac rehab program. But yeah, it's never too late to make changes or to try and improve things and manage those risks.
Good stuff.
I
Thank
just
you.
add, I mean, I think if somebody's had an event like that, it is really important to get back to normal activity. And it is difficult, and it can be quite a shock when you hear that you've had a carotid endarterectomy or had a stroke or whatever, or a heart attack. But it is really important to try and get back to normal, and in a sense to try and put it behind you, which of course is easy to say for me, but it is very important, because the vast majority of people do very well after they've had certainly a carotid endarterectomy, or who've had bypass, or who've had stents, or who've had heart attacks, and even many patients who've had strokes. The vast majority of them do really well, and it's very important if you're fully able to get back to normal activity.
Good stuff. Thank you, Jim and Zoe. So to finish out, I'm going to come to you on the spot for a key take-home message. It's a toss between who I'll go to first. So
I suspect we'll have the same message, but
Probably.
let Zoe go first if she wants.
I'll go to you then, Zoe. There you go, chivalry at its best. So Zoe, if I can go to you for your key take-home message. There's been lots of messages this evening, but what's the take-home?
Yeah, so my key take-home message is know your numbers, so get your blood pressure checked, know what it is and what it means. Cholesterol, get it checked, check for diabetes. Don't be frightened to ask to have them checked, and make a note and keep a record of them, and it's never too early to start getting them checked either. So everybody should at least be once a year having sort of, I say, an NCT for your health.
Okay, good stuff. We look after the cars because we want to make the journeys. So this is the journey of life. So we're going to keep our own body healthy like the car. Great stuff, great message, and thank you, Zoe. Jim, over to you.
I think my message is really the same. Get checked, know your numbers is really, as Zoe was saying, is what's really important. I think the other message is that, the vast majority of people, even if they have overt signs of heart disease or stroke, do very, very well. And the number but you can make yourself do better if you get everything checked. So it's the same message.
Okay, good stuff. Well, thank you both. So it's been a wonderful evening, lots of information. I suppose the encouraging thing is lots of information about how much support is actually out there. And our thanks sincerely to our local heart and stroke charity, Croí, for all the support and the information that you provide on a regular basis. It's really good. And to know that there's a distinct and specific initiative coming up for us Mayo people, which is great. So thank you to Professor Jim Crowley for this evening. Thank you for joining us, and to Zoe McCrudden for being with us here this evening. My thanks also to Vermillion Energy for supporting this event this evening. It has been a really wonderful evening, and I hope that we've addressed a lot of your concerns and queries. I'm going to be sharing some information in a few moments on the various supports from Croí and some upcoming events. And we will have the Heartlink West number in just a few moments as well. So I hope for those of you who might have a biro beside you that you'll be able to take note of this as we go through. So I suppose starting off, and Annie there in Croí is going to share some slides for us, and thank you, Annie, for that. So the first one here is a special invitation actually to all of you who have joined us this evening to join the Croí Health team for an interactive evening, which is next week on Wednesday, the 18th of August from 7 to 8 p.m. And you will get an opportunity to meet the Croí dietitian, the Croí physical activity specialist, and also the Croí health psychologist on that evening. And it's all about minding your heart health. You will receive an email tomorrow from the team at Croí, and this will be an opportunity to receive the link and information on how to register for that evening. And if you provide your postal details in response or in reply to that email, Croí will send out a copy, and you can see the picture there of the Healthy Living Workbook, My Goals workbook, which is a really useful booklet to accompany the session next week, and also to help you to maintain changes over the coming weeks and months. So moving on to the next slide then. It's all about Croí's next public webinar, which is taking place on the 26th of August at 7 p.m. And if you head over to www.croí.ie/webinar, you'll find the details there on how to register for this particular evening, which will be focusing on the important topic of emotional recovery after a cardiac event. So save that date if you can. So moving on to the next slide then. You will have heard Zoe mention this evening all about the Heartlink West helpline number and the helpline service that is provided by Croí. And this is where you can speak directly and confidentially with Croí's cardiovascular nurse specialist. You can call this helpline if you have any further questions on foot of this evening's webinar, or indeed any concerns related to your heart health. And that number is 091 544 310. You might also like to check out the free weekly Heartlink West virtual chats with the Croí Health team. These are interactive discussions via Zoom, covering a different topic every week. Everything from understanding your high blood pressure to healthy eating to physical exercise and stress management. And then on the next and final slide, we have provided some information about the HSE Living Well program, which is a program for adults with long-term health conditions. And this includes individuals living with any of the heart conditions that we mentioned this evening. It's a free online group program. It's provided over 6 workshops, and it's run by trained leaders, many of whom are also living with long-term health conditions themselves. So they understand the challenge and the difficulties sometimes in managing a long-term health condition. This program is designed so that you will develop self-management skills and confidence to live well with your health condition. And to book your place, you can contact the Living Well coordinator, who is Jackie Lynott. Her phone number appears there, which is 087 7185 615, or indeed you can take a look at the webpage on the HSE platform, which is www.hse.ie/livingwell. So from myself, I'd like to thank you all for joining this evening from the Erris community. I've really enjoyed the evening. I hope you have too, and I hope we've answered a lot of your queries and questions. And I suppose my final take home is I hope all of the information you have gleaned this evening is something that will help you on Saturday evening at 6 o'clock when Mayo take on Dublin, and that your hearts won't race too madly over the course of that evening. The very best of luck, and thank you all.